Welcome to the Increasing Language Access in Oregon Learning Module Series. This Learning Module Series presents content from a resource called Increasing Language Access in Oregon, a workbook for providers, which is a plain language, actionable workbook focused on meeting language needs in healthcare settings. There are a total of 7 modules in the series, all of which are intended to be alternative format materials to the different chapters and appendices of the workbook. All recorded modules are available on the OHA Transformation Center website. This module focuses on Chapter 4 of the workbook, the Oregon Healthcare Interpreter Registry. After covering the specifics of providing interpreter services, Chapter 4 looks at one of Oregon's tools for ensuring quality, the Oregon Healthcare Interpreter Central Registry. The chapter explains what the registry is and why it exists. It describes what information is included in the registry, like interpreter names, registry numbers, credential type, languages, and contact information. It also clarifies provider responsibilities to prioritize registry-listed interpreters whenever possible. It emphasizes working with credentialed interpreters from the registry to ensure that providers meet Oregon law and support consistent, high-quality interpretation across health systems. The Oregon Healthcare Interpreter Central Registry is a statewide, legislatively mandated database of credentialed interpreters. It's maintained by the Oregon Health Authority, or OHA, and serves as the official source to verify whether an interpreter has met Oregon's standards for training and competency. The Central Registry helps ensure that interpreters providing care across the state meet consistent quality and professional benchmarks. Let's talk about why the Central Registry exists. Oregon law requires that any provider who receives public funds must work with interpreters listed in the Central Registry when serving patients who speak a language other than English or who use sign language. This requirement is broad. If a provider receives public funds for even a single patient, then all patients seen by that provider must receive care that meets Oregon's healthcare interpreter requirements, regardless of how an individual visit is paid for. This legal standard ensures that patients receive interpretation from professionals who have completed OHA-approved training, demonstrated language proficiency, and met all OHA credentialing standards. The Central Registry, in short, ensures consistency, compliance, and trust in interpreter services across Oregon's health systems. Each interpreter listing in the Central Registry provides detailed information to help providers confirm interpreter qualifications. This includes the interpreter's name, their registry number, the languages offered, the credential type, whether qualified or certified healthcare interpreter, counties served, contact information, and schedule availability. Providers can use this information to make sure that interpreters meet OHA standards before scheduling them for patient encounters. Using this resource is a simple way to ensure your organization is meeting Oregon's legal and quality standards for language access. Working with interpreters listed in the Central Registry is both a compliance requirement and a best practice for providing equitable care. Working with registry-listed interpreters ensures quality, trust, and patient safety. It also helps providers track interpreter use and maintain accurate documentation. Working with credentialed interpreters supports compliance with Oregon law and demonstrates your organization's commitment to equitable care. It also builds patient confidence, showing that interpreters are trained, professional, and impartial. This concludes the module focused on Chapter 4. To summarize Chapter 4, the Oregon Healthcare Interpreter Central Registry ensures that interpreters working in healthcare settings are properly trained, tested, and credentialed, and that every patient receives care that's linguistically and culturally appropriate. In Chapter 5, we'll talk about Oregon's Meaningful Language Access Measure, how it works, how it's reported, and how it helps health systems assess and improve language access over time.